County Health Department School Health Update. Today is Thursday, May 25th. And for those of you who may not know me, I'm Matt Schmidgall. I'm the Program Manager for Youth and School Communities here at the Health Department, just filling in for Michael this morning. Our agenda for today, we have a few quick announcements. Most of these are just repeat announcements, as is the information about the Not Alone initiative, but we'll go ahead and remind everyone about that. We have members of our epidemiology team here this morning to give a quick update on what we're seeing in terms of COVID and maybe what to expect as we enter summer. And then we're just going to talk really briefly about what you all can expect this summer and this fall in terms of updates from the health department. And then we have a brief survey that we're hoping you'll provide some feedback for us on. All right, quick announcements. These most of you have seen before. As a reminder, we do have Narcan available for all schools. Currently, we also have some wall mounts available if you would like to request a wall mount to make naloxone accessible on your school campus to everyone. Just reach out to school support. We'll be happy to get you a wall mount as well as coordinate distribution of any Narcan for your school campuses. We also continue to provide COVID test kits. I do want to mention in terms of the test kits and the PPE, there were a few links previously that schools could use to request that PPE supplies. We're going ahead and phasing out those request links because those haven't been utilized in a while. But we still have the supplies. If at any point you need masks, cleaning supplies, anything like that, feel free to reach out. We can coordinate a pickup from our warehouse for you. Our vaccine equity team continues to offer vaccine clinics. So if you would like to, especially later this summer during enrollment, if you would like to coordinate vaccines, COVID vaccines to be available at your schools, we'd be happy to help arrange that. You can reach out to Vaccine Equity Scheduling at pima.gov, and that team would be more than happy to assist you. The Pima County website has been updated. Hopefully you'll start to see a new revamped schools website. This is something that we're looking just to make the information, the programs that we are able to offer to our youth communities a little bit more accessible, digestible. We want to make it really easy for you folks as well to be able to get the information you need that we offer at the health department. If you have any ideas about that or have any information that you would like us to have available online, please let me know. This summer, we're going to be taking a closer look at how to improve our website. We're also assessing interest in EpiPens. We know that sometimes schools have difficulty acquiring EpiPens. We encourage all schools to have those available. If you need help, reach out to us. We might be able to assist in getting you stock epinephrine to have in case of emergencies. And then I already mentioned the wall mounts, but please reach out if you need a wall mount for Narcan. Our Not Alone initiative is continuing. So as we finish school, this could be a prime opportunity to get families connected. If you have any young people at your school, families that might be interested in connecting with a behavioral health provider, or maybe would be a good idea if they connected with a behavioral health provider, but are feeling a little hesitant or scared or nervous about what that might entail. This is a great way to introduce them into mental health supports from a local provider. This program does not require any intrusive intake, and usually they can be seen quite quickly through COPE Community Services. Really a great opportunity for young people or families just to ask questions about what it means to get connected. And maybe alleviate some of that hesitation around seeking support. And with that, I would like to turn it over to our EPI team. I think Anissa is on the call. Anissa, I'll turn it over to you.
Okay, hi, good morning, everyone. So we don't have any slides for COVID per se. It doesn't necessarily mean that COVID has gone away. So for instance, this morning I checked our reporting queue. They still get reported to us. The state health department and our team still work up outbreaks in congregate settings. So just so you're aware, we have 456 cases reported. There have been 5 deaths in the last 5 weeks. Now, obviously, the 5 deaths in the last week, I'm sorry. Obviously, it's gone down significantly. We're at low transmission level in the community, but that doesn't mean that it's not occurring. So just keeping that in mind. And with that said, this summer, we're going to be working with the schools team. We're trying to work with the state health department and provide some guidance for the schools. I was very fortunate to participate on TUSD's school call last week, and they're very proactive in trying to get started for fall. As you know, there's going to be a mix of COVID, influenza, RSV, other respiratory viruses that circulate is what we call the common cold viruses. But in combination, when you have co-infection, that can be detrimental to classrooms in terms of everyone calling out. And so how do we mitigate that? So we'll be trying to look at that this summer. Other things that also get thrown in the mix, as you know, right now we're seeing quite a bit of GI illness. So our teams are working those up in early childcare education centers. As you know, most of those kids have siblings in schools. And so that's a really easy route for transmission. So we're working on those. Also working with rabies education. As the fall comes up, we tend to see more bat activity. And so we're working on doing some guidance and just some education to do more outreach with the schools like we used to do. So that way, if you request a presentation on rabies awareness or any information about that, we can provide that information to you all. And we're here all summer. We know that you're off, but if you have questions and you want to, like, say, get proactive about some certain topics in regards to infectious disease or hand hygiene, anything like that, we're available. So that's all we have here today. But if you have any questions, please feel free to send them in the chat, or you can send them to Matt and he'll forward them to Effie. Thank you.
All right, thanks, Anissa. All right, we mentioned last week there might be some changes coming to our schools calls. So just a reminder, today will be our last webinar bi-weekly call for the summer. We're going to take a slight pause from these calls and probably resume late July or August, probably a couple weeks before most schools start again. That's not to say that during the summer, our team is not available to assist. So we know that many are still reporting. There's still summer schools, and there are schools out there that go year round. We're available. If at any point you have questions, you can reach out to school support. You can reach out to myself, and we're even more than happy to arrange a meeting with your school leadership or the staff that would just like an update on what's going on. That being said, we are looking at ways to better communicate health information out to schools. And so we're looking at a few different possibilities. That could include maybe a periodic newsletter. It could include, in addition to these broadcast type updates, maybe we want to have more of a conversation and allow for more dialogue. Perhaps we want to expand these once in a while, every few months, to a more professional development style workshop where health staff can come and learn new topics that they can bring back to their schools. So more information on that to come. We're kind of assessing in the next few weeks on what that might look like. And I know we're going to share a survey in just a bit to ask you all to help provide some feedback on that. I would also just like to introduce a new member of our team. So we've hired a new school health liaison on our team. So I'm going to invite Christopher to unmute and introduce himself. Christopher is our new school health liaison, so will probably become an excellent source and main point of contact for school health staff, school nurses to reach out to. We wanted someone on our team. I don't know if everyone realized this, but these calls and our team actually resulted out of pandemic funding that the health department acquired. And that grant funding is ending in a few weeks. But the health department recognized the value of these calls, the values of working with our schools. And so we have plans in place, funding in place to continue that. And one of the roles we wanted to continue was our liaison support. So with that, Chris, go ahead and introduce yourself.
Hello all. Yeah, so as Matt said, my name is Christopher Kroll. I'm the school health liaison for Piedmont County's health department. We will be sending out a survey just shortly, but we'll be like overseeing some ways to better engage all the schools and just ways to increase. I'm really excited to work with all of you. So, and if you have any questions or comments, email the support line and I'll get to you.
Thanks, Chris. And would you mind throwing the link to the Qualtrics survey in the chat? So you can also use your QR code because you know we like QR codes. So it is on your screen. We're probably going to end our call now just because we want everyone who hasn't already to just take, really, it's only a few minutes to fill out this survey. Let us know how we're doing. We're open to critical feedback, so you can tell us what you would like to see different. But if there are things that you do value and enjoy, then please tell us what you would like us to keep as well. And we'll probably leave that survey open for the next week or so, and it will be released in our follow-up email as well. And I see Chris did throw that link in the chat for you all. Our resource slide, these will all be sent out in the follow-up email. There's our contact information. We're around all summer. And with that, concludes our call and our last call for the school year. If there are any questions, feel free to ask them in the chat. We can hang out for a minute or so and see if we have any questions. All right. Well, I'm not seeing any questions in the chat. I just want to extend our gratitude on behalf of our team to all of you. We really appreciate all the work you're doing, keeping our students, families, and all school staff safe. We really appreciate our partnership with you. So excited to continue that over the summer and in the school year to come. So with that, I'll let you all go. Have a wonderful rest of the week as you wrap up the school year, and we'll be in touch. Thanks, everyone.